Well, to Plateau State, where the Governor, Mutfwang, has ordered the immediate closure of Saint Academy. Mr. Mutfwang gave the order when he visited the scene where the building collapsed. Senior reporter Funam Joshua has more on this.
This is the remains of Saint Academy after the state government ordered the demolition of all the buildings situated within the premises of the school. Plateau State Governor Mutfwang is here with a delegation of government officials to see for himself the situation of things. It's just barely a day after the Saint Academy building caved in, trapping school pupils. Now, this is what is left of the edifice that serves as a citadel of learning. The principal of the school, who is still in shock, narrates how it all happened to the state governor.
And so had a breaking that as a principal, I never negotiated for that.
After he was conducted round the scene, Governor Mutfwang proceeded to the Bingham University Teaching Hospital, where some of the survivors are receiving medical treatment. These patients comprises some of the victims receiving medical attention. Esther David was among the survivors, and this is her story.
We're just relaxing, so a student came to call us to go for another class. Before we could leave the class, it collapsed on us, and when it collapsed on us, we struggled. We were 11 in the class. All of us struggled out. Only one person in the class died.
After the tour, the governor has this to say.
It has been a painful one for me, and I've gone round to see some of these little children in pains, and mothers who lost their dear children is something we need to avoid. We can't continue to blame Satan and blame demons when we ourselves should take responsibility. Like we have said, that school starts shut down.
22 students have been confirmed dead, while about 155 sustained various degrees of injuries. A 3-day mourning period has been declared by the state government. Funam Joshua, TVC News, Jos.
And for more on this, I'm being joined by the chairman, Plateau State branch of the Nigerian Medical Association, Babikan Audu. Good to have you on the news at this time. So first off, it has been a traumatic experience, I would say, for the children who were rescued from the tragic incident. But first, how would you describe how the survivors are coping with this emotional trauma, and what kind of support is being provided for their mental state?
All right, thank you very much. Let me begin by empathizing with the victims, their families, as well as the government and citizens of Plateau State over this very, very unfortunate and needless situation we have found ourselves in that's resulted in the loss of lives of innocent children as well as some members of staff. To your question now, fortunately enough for us, most of the victims from the unfortunate incidents have responded well to treatment. A good number of them have returned home to be united with their families, while some who had sustained varying degrees of severe injuries are still on admission at the various treatment centers we have here on the Plateau, particularly the Jos University Teaching Hospital, the Bingham University Teaching Hospital, Our Lady of Apostles Hospital, and the Plateau State Specialist Hospital. Now, a lot of work is ongoing, particularly from the State Emergency Medical Service and Ambulance System, the Ministry of Health, as well as other government agencies and other non-government actors. And a lot is ongoing at the present time to see that a lot of the needs of course, it's a public health emergency. The persons affected, the numbers is quite high. So rolling out any plan is not usually going to come without some challenges. However, there are plans on ground for some engagement with the community, as well as the families of these victims, to be able to offer them some services that will help them psychologically get some support. We here on the Plateau as an association, we have a dedicated committee on mental health, and that committee has been fully activated. In the next coming days, we'll roll out some of our activities to see that we are able to assuage some of the feelings of these individuals to help them return back to life. as soon as possible.
Right. Now, in terms of medical support, you also highlighted what kind of long-term medical care will those survivors need, especially those with severe injuries?
All right, that will depend on the type of injury and the part of body affected. We cannot just put everybody in one category. Every patient's condition is unique. Every human being is unique as well. So the extent of the injuries will determine what the outcome would be. However, we do not expect so much untoward consequences arising from the injuries that are severe enough. That's as much I can say. Of course, have to keep some things confidential at this point. Okay. Nonetheless, the quality of care they are receiving is top-notch, I assure you this. And I must commend the government of Plateau State for the swift response, for shutting down the school, and also for offering to pay the costs of the medical treatment of these victims.
Right. And with that being said, what policy changes now do you think are needed to ensure building safety and, of course, prevent future collapse? What can you tell us about this?
All right. A lot has to be done in terms of regulation. And citizens of this country need to also wake up to their civic responsibilities. When you see wrong ongoing and you refuse to report that wrong, you are also a party to it. The regulatory agencies have to sit up to their duties. And of course, this is not something that's just peculiar to just the building industry. Even in our own healthcare space, we have a lot of quacks that are operating. So a lot of work needs to be done across the different levels of government and even the different levels of populations in Nigeria that we have. On an individual level and on a collective level, the inspectorate unit of the Ministry of Education should be strengthened further, be provided with what they need in terms of operational vehicles, etc., to be able to go around and monitor these schools. And the proliferation of these private schools is a pointer to the fact that a lot of government institutions are not working. Because if government schools are working, of course, the standard of building will be higher than what we are seeing. Because that school, that Saints Academy, it was not originally intended to be a story building. It was supposed to be a bungalow, yet they found a way to unprofessionally bring in some sort of pillars and put 2 extra stories on that building. In addition to this, the lack of regulation allowed that school to be able to have a student population for each class which was outrageously high, beyond the stipulated number that is expected for a given class. Right. You have classes that have students up to 80.